So we're going to discuss the muscles of the upper arm, and the first is the biceps. Fascinating muscle, which has two heads. There's the short head and the long head. The short head attaches to the coracoid process. So you can see as I lay the shoulder down, the coracoid process is quite a big fat process. There's a big strong tendon which attaches here. The second, which is the long head, runs up through here, and if you look, you can see there's a groove in the proximal humerus, and the long head runs up through that groove and comes over the top of the joint, inserting into the glenoid fossa. And these two have quite different functions. So if I was to draw, the coracoid process is in the depression in the front of the shoulder, quite a fat process. So if I draw that, and then you've got this quite broad tendon coming down, and it comes down the front of the shoulder. And then if you feel in the front of the humerus, you'll feel a couple of bumps which correspond to these, the tubercles of the humerus. And as you run your finger over, you can feel the actual tendon running between your fingers, flicks backwards and forwards. And so if I was to draw that, here is the origin. The tendon is a lot thinner. It runs down like that. Now they both join together, and you get the two muscles joined together to make the belly of the biceps. So if I draw that big, like that, and then this comes down and it comes round like that. And they actually fuse at about this point, and they form the lower tendon of the biceps. Now the lower tendon of the biceps runs down, and if you turn your arm round, they actually run into the inner side of the radius here. So the short head of the biceps actually runs across two joints. The first is it runs across the it attaches here, but it actually runs across the elbow joint, causing flexion of the elbow joint. However, it also attaches into, because it attaches into the radius, as it contracts, it will turn the radius around it, because it attaches to the inside, and therefore it will supinate the arm. The long head runs across three joints, and there's not a lot of muscles, if I can get this right, there's not a lot of muscles which run across three joints. And when the long head contracts, it pulls the head of the humerus into the glenoid fossa, and therefore it stabilizes the shoulder so that the big power muscles can move the shoulder around. Very much like the supraspinatus muscle did as well. Okay, so that the functions of this muscle are, firstly, the functions of the long head across the shoulder, and then the second is it will flex the elbow, and the third, it will supinate. And the way to think of the actual function of the muscle is that if you were to lift and flex like that, if you were to lift something and put it into your mouth, that would be the primary function of the biceps muscle. The triggers occur in the main bulk of the muscle itself. Here, in the lateral portion of the biceps, and here, in the medial portion of the biceps. The triggers, because the muscle fibers run longitudinally, as you feel, you can run your hand over and feel for tight bands. And often the way you find it is actually to pinch the muscle between thumb and fingers and run your fingers backwards and forwards like that over the muscle. You'll feel triggers. You'll feel tight band, and once you found a tight band, then you run up and down a wee bit and you'll find a trigger. The triggers cause pain in the muscle itself, but they also often refer pain up proximally over the front of the shoulder. So this is one of the anterior shoulder pain, is in fact the biceps triggers. And the medial trigger refers pain down into the cubital fossa. Okay, so this is a power muscle complex affecting both the shoulder and the elbow and rotation of the forearm. So now, if you want to treat these triggers, you search for the trigger. Once you've found a trigger, you apply ischemic pressure, and you can see that what my choice is: either I push straight down, but that actually is fairly difficult when you come to the medial trigger, because it's just technically difficult, and it's easier to use your thumb as a support and squeeze. So I'm doing a pincer movement, and once I find the trigger, I then apply ischemic pressure, the ischemic principle, finding the pain, just hard, ow, that's sore, reduce pressure, and then slowly increase the pressure until I've turned it off. So the next way to treat it is with cold and hot. And oopsie, so the cold is a cold pack, and you start always at the origin. Now, as you're going over the origin, you're also actually going over the pain zone, which is fine. So you start at the origin, you move over, down into the muscle itself, ending up in the insertion. And you do 2 or 3 of these. Now, because the muscle runs across 3 joints, the stretch is a little bit complex. And the stretch is that you extend the elbow, you pronate, which is stretching now, and then you extend the elbow backwards. And as you do that, you then can run the cold maybe a couple more times, then relax, put a heat pack on and over the muscle, leave that on until the arm is nice and warm, and then you do the stretch again. Extend, pronate, extend shoulder.